Reflection of a Radiologic Technologist. I started this course with preconceived notions about what it means to be a radiologic technologist. I thought that this job would mainly entail conducting diagnostic imaging procedures, such as X-rays, MRI scans, and CT scans. However, I have learned that a radiologic technology career demands so much more than this. Working with a mentor allowed me to learn more about this career, and I have developed a new appreciation for it. As a healthcare provider, I now know the importance of communication and the need to check my unconscious biases. Interacting with my lab mentor allowed me to see the practical aspects of radiologic technology. Prior to this, I had a lot of theoretical knowledge about how procedures are conducted. I got to see my mentor performing and, sometimes, interpreting results. Perhaps the most important thing I learned from my mentor is the importance of making the patient feel comfortable. Though radiologic technologists encounter many people every day, each person is unique and should be treated as an individual rather than just another statistic. People undergoing imaging tests are often scared of the results. My mentor taught me that I am responsible for ensuring the patient feels relaxed. Another critical aspect of radiology that I learned is communication. I used to believe that technologists do not communicate directly with patients because they send the results to the primary physician, who then interprets them for the patient. However, I now believe that all healthcare providers need to develop strong communication skills. For instance, one study found that radiologists who directly communicate with patients to discuss imaging findings have a higher bond with the patients. They are also considered more competent and increase confidence in the service provided. Thus, it is essential for me to learn how to communicate with other healthcare providers as well as patients. Besides communication, I learned the importance of evaluating my implicit bias. A person may have prejudices that affect the quality of care they deliver. For instance, implicit racial bias could make a radiologic technologist more thorough when conducting tests for white people than racial minorities. This can lead to delayed diagnosis when radiologic technologists do not conduct the necessary diagnostic imaging in time to catch a disease. Though unintentional, implicit biases create health disparities between different populations. As a healthcare worker, I have a responsibility to unlearn any implicit biases I may have. Creating awareness about unconscious biases can help in providing better care. Some medical professionals may propagate certain prejudices without even knowing they carry these biases. Hence, creating awareness is the first step in reducing implicit bias in healthcare provision. Additionally, it is vital for medical providers to develop cultural competence. They need to be aware that they will encounter people from diverse cultures and backgrounds. Professionals should learn not to let their beliefs and life experiences affect how they relate with patients who are different from them. In conclusion, this course has been deeply insightful in understanding patient care. I used to mistakenly believe that radiologic technologists are robot-like since their primary duties revolve around operating machines. I now understand that this career necessitates soft skills, such as communication. I also realized the importance of interprofessional collaboration between radiologists, physicians, and nurses. Often, technologists work with other healthcare providers to provide accurate diagnostic imaging. The bottom line is that communication skills are integral to the practice of radiologic technology.